Thanks for having me here today. I'm Erica Lycan. I am here, I guess, for several reasons. I work for Growing Hope, which is a local nonprofit, and part of our work is to, excuse me while I put on this thing here. Part of our work is, and really our mission, is to help people improve their lives and communities through gardening and through healthy food access. So we have a lot of stake and investment in kind of the local food, healthy food, fresh food access, which is what I'm going to talk about here today. I'm also personally invested. I'm part of the Think Local First board and just very interested. So I was glad to come and listen and speak and hear and learn. So thanks for having me today. I will just highlight real quickly a little bit about what Growing Hope does, kind of through these pictures here as a narrative. As I said, you know, our main core of our work is several gardening programs, some youth nutrition programs. We also run the downtown Ypsilanti market, which is one of 2 farmers markets in the Ypsilanti area. So we're involved in a lot of different ways and really have benefited from the Farm Bill funding in many different ways, and it impacts a lot of the work that we do. These are some of the pictures from the farmers market and different vendors at our market here. And I'm kind of going to address it from a farmers market Growing Hope-y kind of lens, just because that's the lens that I come from, but I think I'll be able to tie it back to food access in general and how it can be improved. The first thing I want to talk a little bit about when we're talking about food access is food security, or maybe the negative version of that, which is food insecurity in Ypsilanti and in Washtenaw County, kind of southeastern Michigan. A lot of you probably have heard the term food security, or in its adverse, food insecurity, but what that really is, in our view, is a lack of access to several of the following types of foods. Foods that are culturally appropriate, safe foods, so meaning, you know, they're fresh and not spoiled, et cetera, healthy foods and affordable foods. So at Growing Hope, and I think in the community of people that we work with, we consider someone to be food insecure if they cannot meet any one of those needs. So we kind of view it from a lens of addressing food insecurity and how can we get people to that point where they're able to access food that's culturally appropriate, safe, healthy, and affordable. Just to kind of set the setting of, I mean, all of you live in this area, but you know, obviously the city that we live in and the county that we live in is dealing definitely with some food insecurity. About 25% of Ypsilanti residents are food insecure, and again, it doesn't have to be all of these ways, but are food insecure and live well below the poverty line. And about 60% of the city's renters spend more than 30% of their income on housing. And so, you know, when you have other costs, you have to choose: do I want healthy food? Do I want to pay the rent? Do I want to pay the utility bills? You know, there's a lot of challenges that are facing people that are lower income and that would still want to buy healthy local food. I think some of the main barriers that we have here in southeastern Michigan to food access are, again, based on the food security standards, are people able to get to that food? So is it literally accessible from their house or where they live or where they're staying? As you might know, there's not a official, which is maybe good, large chain grocery store in the city of Ypsilanti, which we have the food co-op, which I love. But you know, part of that is making aware that the food co-op is there, that they take SNAP and EBT benefits, which again are funded by the Farm Bill. But you could kind of consider Ypsilanti to be a food desert if you didn't know about the farmers markets and the, you know, Dos Hermanos Spanish market and that kind of thing. So part of that is addressing the availability. Again, the convenience is the other thing. Are they able to get there in a way that's convenient? If you're someone that's juggling several jobs and has children, are you able to make a trip out to the co-op? Are you able to make a trip out to the farmer's market? Are those located in places that you can easily reach them? Is it much easier if you have SNAP/EBT benefits, which I will talk about a lot? Is it much easier to go to the corner store that, you know, has several green peppers and several tomatoes that have been there for a long time? So again, helping to address that kind of convenience aspect. And then information, really letting people know the resources that do exist. There are a lot of resources in Ypsilanti, in Washtenaw County, places that accept EBT SNAP benefits, places, I would say even larger stores that, you know, you see little Made in Michigan and folks that are really trying to promote Michigan growers and Michigan food, but making sure that the people who need that the most know how to get those foods. We all take that for granted because we can Google and internet search and just, you know, pull things up very quickly, but not everyone can do that. And then I also thought, I know I was kind of framing it from a food access in the point of a consumer or someone who might use SNAP benefits, because that's how we work with people a lot of the times, are people that are lower income and maybe need to utilize those. But I was researching kind of how access could be affected from a retailer standpoint, and something that I found was that retailers reported insufficient supply or seasonality in connecting with producers. Like Jeremy was saying, a lot of the times people that want to source locally don't know how to get that access to the local food, so kind of bridging the gap. Something I'll talk about later on here is we got some grant funding through the MEDC to actually do a directory of our market vendors, and I'll go into that a little bit more. But how do we connect, again, the fresh food not only with people who need it the most financially, but with people who want to sell it and want to promote it. Changes to the Farm Bill, we've talked about this a lot, so I'm going to skim through a lot of them, but I'm just going to highlight several that definitely affect A, Growing Hope, B, the city of Ypsilanti, and C, people who are affected by food access, which is really everyone, everyone in the world. So as we talked about, the new name for the program as of 2008 is SNAP, Supplemental Nutrition Assistance Program. So that's even a big thing, is just educating people on what the new name is, even people that receive the benefits, when they're asking and looking for, oh, do they take EBT, knowing what EBT stands for, things like that. Helps restore the food purchasing ability of low-income families. There's been some increased funding in 2008, and like we were saying, some really supporting of these programs, and we'd love to see that continued, because that's really helped people get access to those foods. Like I said, I was getting ready to do this really thorough overview, and I'm gonna pass through a few of these a little bit. Community food projects there, that's a great way to get local people that are already engaged and involved some funding to be able to do those projects, and they're locally funded, they're locally sourced, they're run by people who know the issues in the community, and that's great. I thought I'd talk too, when we're talking about access, again, thinking about it in a holistic way. It's not just the people who need to eat the food that can't have access to it, but it's making sure that farmers markets are accessible, making sure that farmers are able to sell at markets. At Growing Hope, since we do run a market, we not only think about customers getting there and spending and clear signage, but for farmers and vendors, are we making the market hospitable for them? Are they able to make enough money to want to sell there and feel like that's a happy environment for them? And it's a kind of a tough balance to be thinking about the consumer and the producer, but when you're talking about food access, half that battle is if the people that want to provide the food can't afford to because they are not making enough money at the market or at the grocery store or wherever they're selling, that affects food access too. So trying to support people from all avenues here. Talked a little bit about organic production. Jeremy talked about that. So some positive food steps towards food security that I feel like are happening right now in Washtenaw County are a lot of partnering with local agencies that are addressing food access. I think you've heard about a lot of them today. I'm going to kind of go through and talk about the organizations we've partnered with, but how the Farm Bill has affected that and how that's helping our work today. Food Gatherers, I'm sure you're all familiar with, is a local organization that does food collection and runs pantries and really connects people that need food to food. They actually, for the past year or two, have had a stall at our market and can actually tell customers if they're eligible for food stamps. Again, food stamps, see, for SNAP benefits. I'm getting used to the language myself. Can tell people if they're eligible for SNAP benefits and can actually sign them up online right at the market, which is really nice. So, but again, providing that literal, okay, you're not signed up, we can sign you up right here, you're already here. So that's been a great partnership. Washtenaw County Public Health, we take several benefits at the farmers markets, and actually in the whole area there are a lot of markets that take several food assistance benefits. There's obviously SNAP benefits. There's a food program called Double Up Food Bucks that is funded by Fair Food Network, and that will match your EBT benefits up to $20. So if I have an EBT card and I swipe it and I say I want $10 please, I get $20 and I only get charged for $10. That has been a really successful program, and it's really like free money to incentivize people to shop at the market. People are delighted with that, and I think really gets over that stigma of, oh, it's not affordable, which is, again, one of the food access barriers. Well, it is, A, it's pretty affordable as it is, but B, here's an incentive to really spend your money and support local farmers. So some of the other benefits and programs that we take are Prescription for Health, which is a local program that is run through Washtenaw County Public Health. And if you're part of a client of several of the clinics, they actually give you a prescription for health for fresh fruits and vegetables. So not only do we take those tokens at our market, but there are several nutritionists from Washtenaw County Public Health there to talk about nutrition with the clients as they come up, to sit down and have a dialogue. And that's actually a required part of the program, is they need to sit down and talk about the benefits for several minutes and talk about how to use them. So that's been a great partnership for us. Again, something that we wouldn't have the staff or time to do on our own, but since Washtenaw County Public Health runs that program, it's been a great way to add some nutrition education to what we're doing. Michigan Department of Community Health and Michigan University Extension Office, they help to facilitate the WIC Project Fresh education. So again, talking about Project Fresh and Senior Project Fresh, with some of the funding comes from the Farm Bill. Those are things that we utilize every day at the market that people in the community are really able to buy healthy food with. Local food cooperatives, we have a food co-op that we love in Ypsilanti, and there's a great one in Ann Arbor too. And again, really partnering with things that they're doing. Not only do they take SNAP benefits and really try to accommodate folks that want to have access to healthy food and maybe don't otherwise, they're also present at the market, so it's a nice way for us to promote them and say, look, there's a co-op right here, it's walkable, it's very close. Local hospitals and health centers, again, we've talked about that a lot throughout the evening already. We've formed a great partnership with St. Joe's, as some of you might know, who has a big hoop house on their property and is really excited about farming and local food anyway. They have come to our market every last Tuesday and done some kind of educational programming. So 1 month they had some information about free breast cancer screenings. 1 month they had information for kids, and they had free bike helmets. Again, something we couldn't provide on our own, but have really networked with, and has been a great partnership. And I think St. Joe's is able to let people know about the resources that they have that especially serve people that might be eligible for SNAP benefits. So really networking, and then nonprofits as well. I think another note with partnering, as you're talking about partnering in the community, is since we're able to kind of capture the folks that do spend their SNAP money at the market, we want to be able to provide other resources. I think that's a big thing. We talked about accessibility a lot, and if they've traveled by bus, or if they've traveled by car, or if they've biked, or they've walked a far distance, if they've already made the effort to go to that market, there's no reason not to provide health information, sign them up for SNAP benefits if they're not signed up already, give them some nutrition information. So we've really tried to make it an environment where we're making the most of those SNAP benefit dollars. I wanted to talk a little bit about the impact that the Farm Bill funds have had on the market and on the city of Ypsilanti, overall. This information is from last year, I think, but according to the most recent census, 19% of Ypsilanti residents participate in food assistance programs, and 24% live below the poverty level. Again, just to give some context, in contrast, statewide food assistance program participation is 11%, and 13% are living below the poverty line. So we have some real need here, and really trying to address it in a variety of ways. Both our downtown market and the Depot Town market, that's on Saturdays, also, like I said, take EBT, also participate in other incentive programs. So we're really trying to make it a competitive place for people to spend their dollars, again, so people can access fresh local food, but also so their dollars are going back into the community and helping to make our community better. As far as some stats, SNAP dollar used at our market grew 54% compared to 2009. So in 2010, there was 54% more people utilizing SNAP benefits, which is awesome. We really try to promote it, and luckily, we're a small nonprofit, but we have the staff to be able to do some promotion, and we're really lucky to do that. And participation in all of these assistance programs increased from 2009 to 2010, nearly 23% of overall market sales. So as you can see, we're really trying to get a big population, not just catering to people that we know can afford it, but really trying to make it for everyone. This is something I wanted to share with you, which is maybe just a model for to how to share this information. Again, we have all these great resources. How do we get the word out there that people can accept people accept SNAP benefits? Amanda, our executive director, actually made this, and it's really cool. It's a brochure. I just scanned it and put it on here, but it's a list of all the farmers markets in Washtenaw County, and what food assistance benefits they take. So if you go to the next page, there's a list of the markets, and there's a thumbs up if they take SNAP, there's a thumbs up if they take Double Up Food Bucks, and I will just put a plug that if you're interested in this, I'm sure my email is around, but I would be glad to send it to you. We've been really trying to distribute this in the community, talking about access, because we have all these great ways to access affordable, fresh, local produce grown by local growers, but making sure people know about it. So been trying to spread this all around the community and make sure people know. I actually my doctor is at St. Joe's, and I went and I was in the waiting room, and they had one in the waiting room, and they had one in like every room, and I was like, yes, this is an example of a win-win partnership. So that was great to see. We also really try to focus, again, when we're talking about access, on not only increasing customer knowledge, but increasing farmer profits. It's, again, a cycle that you want the farmers to make money so they continue to come back, so people can continue to buy the food. So location, 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 making sure that co-ops, grocery stores, farmers markets are located in places where people with trouble accessing foods are able to go to them. That's something we were very conscious of when we chose our market location. It's right downtown, it's on Michigan Avenue, it's accessible by bus. I was gonna say train, maybe not exactly train yet, but bus, walking, bike, all kinds of things. It's very accessible, and that's really important. If there's great food and it's cheap and it's affordable and we take SNAP benefits and people can't get there, then it doesn't matter how good it is. So, but I think we can always do a better job of that. I think we always can. And also letting those with barriers to access know where, when, and how they can locate fresh, healthy produce. Like I showed that brochure, that's a great example, getting that out into the community. We can't tell each person individually, but what materials can we get out there, and making sure we put them in places where people are going to look for them. Strategically distributing things that, maybe at bus stations and places where people will pick them up and really utilize them. And then also, marketing in locations where the people will need to see it, and clearer signage. Something we did this year that I mentioned earlier in partnership with the MEDC with funding from them is to do this really cool vendor signage. Before, people just kind of put up a sign and it wasn't very clear what they were selling, or and some people had better signage than others, but it has the vendor name on it, it has a Michigan hand to tell you where they're from. It also has a button for each token that they take. So if you have EBT benefits, or if you got Double Up Food Bucks tokens, or if you're doing prescription for health, you're able to scan very easily and say, I have this token, they take this token. So that's just another exciting example, but really making it easy. People shouldn't have to stop and say, I have these green tokens, do you take these green tokens? That's not accessible. So working to improve that every year. For more information, I just listed some resources. Our website is up there, and MIFMA. I guess I would just say in summary that we've benefited a lot from the Farm Bill. I think not only has our community, but it's enabled Growing Hope to really connect the people that need food most to food, to gardening programs, also to identify for youth nutrition programs. So appreciate your time today, and thank you so much.